Yeah, I am Dr. Shankarnag from India. I am with IR Intervention Radiology Center with my friend Dr. Gulaman and Dr. Pavel. So we have been conducted since microwave ablation in gynecology. The indication is fibroid, adenomyosis and endometrial ablation. So the day by day the indication is increasing, like abdominal scar, endometriosis, AV malformation, selective fetal reduction. So first I want to ask Dr. Pavel, how you feel this microwave ablation, it's ablation of fibroid and adenomyosis?
In the first, I want to say that I prefer ablation because this is minimal invasive and very fast procedure and have a very good results, because in 1 year we have results. Our size.
This is actually volume shrinkage procedure. If you can compare with a surgery like a resection, and adenomyosis is very difficult, lot of complications, needs admissions, post-op care, and the uterus is weakness. And when you are doing the fibroid laparoscopy myomectomy, you need morcellation. Nowadays, FDA is banned morcellation. It is endobag morcellation. So putting endobag in the laparoscopy, doing morcellation and suturing, very skilled required, very technical required. Still, end results are negative. So, how you feel this microwave? It easy, anybody can practice.
Yes, of course. We have a little bit practice needed.
Yeah.
But ablation of
fibroid,
every benign lesion,
yes,
even thyroid,
yes,
can destroy that lesion.
Right.
Very minimally invasive.
Yeah.
Very fast, without surgery, without recovery period, and achieve a good result.
Right.
We have an indication. And why the minimally invasive ablation is very preferable method for treatment of fibroids.
Yes, that's what. For example, if you see the avoid hysterectomy, like endometrial ablation, also for AUB, abnormal uterine bleeding.
Yes.
You only you use the hormone replacement or Mirena. Okay, it takes time and the result is not good. Yes. If you are doing TCRA like hysteroscopic, needs skill, a lot of complications. So if you see the endometrial ablation, it's very easy. So do you prefer in future?
Yes, of course. Because the result is best good, and for ablation is the best. Some of the patients is the best choice. Yeah.
For example, even we have been doing in India for adenomyosis for infertility cases.
Yes.
If you compare with laparoscopy, adenomyomectomy and microwave, we are happy we converted to the microwave because less complication, and when you are doing, we cannot remove the 100% tissue pathology.
Yes.
So adenomyosis, again reconstruction very difficult.
Yes.
So
in this case, we can stop bleeding.
Yes.
And very fast recovery.
Yes. And the patient can prefer IVF within 3 months. If your surgery, it needs 2 years, 1.5 years for scar and integrity and strength.
Yes,
strength.
And so for patients too, if we can avoid the surgery, every minimally invasive procedure, changing for minimally invasive procedure is a very good thing.
Yeah. Nowadays, now the scenario changing, sedentary life or the diet, number of unmarried girls are coming with a fibroid, adenomyosis, unmarried girls, young patient. Those are best indicator for the microwave. Do you agree with that?
Yes.
It's okay?
Yes.
So how is the experience? Like this need like just like experience doing laparoscopy is better or ultrasound guided micro is better?
Of course, microwave. Yes.
Ultrasound guided is better.
Yes.
Because I have a big experience in ultrasound guided procedures.
Yeah.
If we can avoid the laparoscopy, even laparoscopy is better.
Yes.
But if we can't, we should
try to avoid laparoscopy. Super minimus. Laparoscopy is a minimal invasive.
And the future is for minimal invasive.
Yes. Laparoscopy minimal invasive. Ultrasound is the super minimal invasive. If you see this, I want to ask one question. When you are doing lap myomectomy, lap adenomyomectomy, people are calling minimal invasive But when you are operating on the uterus, you are doing open surgery. It's big incision. Like a 5 centimeter fibroid, you have to give an incision of 5-7 centimeter on uterus. You got it, my point?
Yeah.
It's only minimal lesion in the abdomen.
Invasive for
Abdomen only.
It's minimally invasive
One for incision,
not for surgery.
Not the surgery. That is the reason.
Yes.
That is the reason microwave it's useful for the infertility cases also. Recurrence also very less, and if you can combine uterinotomy ligation, combination we are doing uterinotomy ligation, you can just, or uterinotomy embolization also you can do, combination of bigger lesion, multiple lesion. Yes. Sometimes if you have a adenomyosis and a fibroid mixed lesion, you can do uterinotomy embolization and microwave. Yeah. For example, if you are doing thyroid, when you are doing thyroid for benign lesion, so it is not only for cosmetic purpose. Cosmetic person, people are doing hemithyroidectomy, transaxillary, endoscopic, transoral. But Dr. Hang from Korea,
we preserve the thyroid.
That's a beautiful. That is a beautiful answer, because when hypothyroid hormone.
Whole life.
Yeah. So whatever you are taking hormone, thyroid tablets, pills, it is artificial, not exactly as a physiological hormone. The brain fog and the sexual dysfunction will be there. That is the reason you are saving thyroid. That is the reason we are do save uterus.
Yeah.
Same thing we are doing, same uterus.
It's very similar.
Very similar thing.
Similar,
yes.
And the results is similar too.
Yeah. So you can all the best in future. We'll invite you in India. You can come in India. We'll practice and will be perfect. And you can conduct some workshop. You can call the gynecologist here. We'll conduct workshop, and we'll do in future. As gynecology, we'll conduct cosmetic gynecology workshop. You know cosmetic gynecology. You practice that?
Yes, of course.
Do you use CO2 laser or diode laser, RBM?
All what you know, fillers, laser, labioplasty.
You do labiaplasty, vaginoplasty,
lifting.
Yeah, you are doing now. Okay, very good.
Treats lifting, you know.
So we'll call you in India for this next time, right?
We
Thank
are
you.
very thankful that you are here in our intervention radiology center.
I'm very happy, excited here.
Thank you.
Enjoy your time here and work with us together. Okay?
Sure.
It's our pleasure to host you here.
Next time I'll come with pain management team.
Very good workshop.
Yes.
Very good, very
nice
high level
things. Yes. Thank you.